Hi, I'm Tom Hoffman with One-to-One Media, coming to you today from the Gartner Customer 360 Summit in Los Angeles. Joining me today is Ingrid Lindberg, Chief Customer Experience Officer at Cigna, which has been awarded the Silver Award for Customer Experience under the Gartner One-to-One Media Customer CRM Excellence Awards. Ingrid, thanks so much for joining me.
Thanks for having us.
So, Ingrid, you and I were talking before about this transformation that's occurring in healthcare, and I'd be interested to hear about how Cigna has approached this with respect to how this transformation is leading companies like Cigna to have to become more customer-focused.
Definitely. So healthcare reform has been a fascinating time for all of us in the industry, definitely. What is even more interesting to me is that Cigna actually began this transformation in 2005, long before healthcare reform was really at the forefront of what was driving all of this. And it really was around our dedication to understanding how people use this system, knowing that if we didn't understand them, we wouldn't be able to help them live healthier lives. So we started this about 5 years ago now. I joined Cigna in January of 2008 to make it really official and to have an office that would lead defining and designing customer experiences. But what we're finding with healthcare reform is that all of the other companies within this industry are suddenly realizing that they need to do this too. So we're very lucky to be able to have a whole slew of learnings already under our belt, which you've recognized with the Silver Award this year, so thank you kindly. Yep. But we are definitely driving forward in this path of if you increase satisfaction, we've been able to create the correlation to that leading to an increased trust in our company, that trust leading to an improvement in health. So we know that if we can make people happier with the business that we have and how we serve them, people are going to trust us more, and if they trust us more, they'll listen to us and let us help them live healthier lives.
Right, that's great. Now, as you mentioned, your organization's been on this path since 2005, and what are some of the learnings that have occurred since then?
I think the most fascinating learning to me coming from financial services industries was all around the language that we use. It is astounding how much of a separate language healthcare has created on its own. It's riddled with acronyms. It is beyond any jargon I've seen anywhere else. And we've studied language and how humans want to interact with us at a very high level. We've learned things like 82% of Americans think that provider is us. We refer to it as your doctor. We think we're talking about your doctor. We found out that 50% of Americans think that co-insurance is the insurance that their spouse has, not what they owe for a procedure that they had. So we've learned so much around language as the basis of everything. We've actually been able to correlate satisfaction to understanding. So that's been huge. The other thing that's been absolutely astounding for us is the fact that we send out something called an explanation of benefits. Think of it as your credit card receipt. When you swipe your credit card, that's what you get when you have an interaction with a doc.
Right.
We found out that almost 80% of people threw them away, didn't even open them, didn't look at them. So being able to help people understand how to get important information into their hands through the channel they want and in language they understand, two biggest learnings.
That's great. And I would imagine that it's also helped to deepen customer relationships by being able to provide more understandable language for customers as well.
The understanding levels are so significant. So we've seen studies that say that 14% of Americans understood what we were talking about when we were talking about healthcare reform. Only 14% of Americans. We have other data that shows that 23% of people sort of understand what's in their policy. When we've rewritten things using our new learnings and using what we refer to as the words we use, we've seen increases over 130% in levels of understanding. So if you use that as the basis for everything satisfaction and everything around how you use your benefits best and get the most out of your benefits, if you don't understand that preventive service could be a free good thing, you think it's bad and you never use it, just think about all of those correlations that occur.
Sure.
So definitely around the understanding.
And even though we're, the transformation of the healthcare industry, as we know it, is still very nascent, it sounds like Cigna is fairly far ahead right now in terms of taking a very customer-centric approach.
Definitely. We're on board with the fact that something had to happen. What we've learned is that this really doesn't help increase quality and it doesn't really increase access. We're still facing a whole boatload of problems within the system, but we know that we're there to help our customers at the end of the day, and our customers are learning that we can be there for them.
That's great. Well, Ingrid, congratulations again.
Thank you.
Thank you so much for joining us.
Thanks for having us.